Myth or fact, food allergy blood testing is beneficial.
Myth.
Okay.
So let's talk about food allergies. So the important thing about food allergic disease is that it is actually pretty common. I know that there's in the past, there were mixed messages about how common this problem is. And I think part of the reason is that prior to the creation or availability of really solid hydrolyzed foods, I think this was actually a pretty challenging diagnosis to make because we have a lot of cross reactivity with whole proteins. So we can talk a little bit more about exactly what that is. But if you're using a novel protein diet, the immune system might not think that's novel. And so you might miss that case. I think practitioners who were relying on that type of diagnostic might have just not been that rewarded by their process. Right? They do a diet trial with, let's say, a salmon-based diet, and the dog doesn't get better, so they move on, and then they think, gosh, no dogs have a food allergy component. But if you ask a lot of practitioners who are really doing a lot of diet work, I think a lot of us believe that somewhere from 25, I even have a colleague who believes 100% of his patients with allergic disease have a food problem. And, I was like blown away that this person thought more dogs have food problems than I do because I do a lot of food work. But the question isn't so much yes or no. Does your patient have food allergy? The question I have and how I phrase it is, what percentage of this dog's problem is related to food?